My name is Professor Amon. I work in Vienna. I'm the head of the eye department of the St. John's Hospital. We have now experience of over 5 years with implanting the Sulcoflex lens. We have implanted that lens in a secondary way, so in patients that needed some correction of their refraction, and we also did it in a primary way, the so-called Duet procedure, in order to enhance the vision of the patient in one setting. We have very good results. We have now implanted over 200 lenses, and the eyes all were calm and very quiet. So as this material, it's a hydrophilic material, hydrophilic acrylic material, has a very high UV biocompatibility, it seems to be well accepted in the eye. We didn't find any tilt, and we only found some amount of decentration. We performed an interesting study where we compared the bag lens of the same eye and the Sulcoflex lens. And we measured the decentration as compared to the limbus and to the pupillary margin. And we found no significant difference between the two lenses. The Sulcoflex lens was a little bit better centered, as compared to the bag lens, but this difference was not significant. We didn't find any major intraoperative complication. We only found post-op some rotation of the lens in those cases where we have implanted toric lenses. I think that's the only problem with the lens in some cases, but on the main there is no complication found. The rotation is important if you have a patient with astigmatism. It's a great idea to correct astigmatism with a toric IOL, but as sulcus lenses are not fixed by the capsular bag contraction, there is always the chance that these lenses rotate to some extent. This can be treated with suturing the lens if there is a rotation occurring. The incidence of this rotation in our hands was less than 10%. I think the main benefit is for those patients who get a Duet procedure with a multifocal Sulcoflex lens. We implant the bag lens for the far distance and add the multifocality of the Sulcoflex lens. So if a patient does not accept this, as this procedure is reversible, we can remove that. It's usually the patients tolerate it very well, but in patients where they get older, maybe they sometimes develop a AMD or a diabetic retinopathy, and in those cases we sometimes would like to put that lens out, and as this procedure is totally reversible, I absolutely think that this is the best idea to implant multifocal lenses in a Duet procedure way. And the second main indication is in secondary implantation, those cases who have a biometrical surprise. It's very easy and very predictable to correct this with a Sulcoflex lens implanted in a secondary intervention. As I have a lot of experience now with the Sulcoflex lens, I would be very happy if a lot of surgeons would try this lens, because I think it has a lot and a wide spectrum of indications, and it helps the patients who suffer in some extent, and you could help them very much with this lens in a lot of cases.